welcome to today's program. We're going to talk about epilepsy and seizures. So what is epilepsy? What is its difference between epilepsy and seizure? How does it occur? Why does it occur? How can we treat it? What are the precautions we should take? All these things are very important. So epilepsy is actually a disease of the brain, whereby an individual gets 2 or more seizures. Now you would be wondering what seizure is. Seizures are unusual electrical activity in the brain, which results in either motor movements or sensory phenomenon, or sometimes even autonomic phenomenon. Autonomic means there will be sweating, there will be increase in heart rate. All these features can be manifested when you have a seizure disorder. Now, seizures come in different varieties. They are actually divided into 2 groups. The generalized seizures, where one develops motor activity or jerky movements of the limbs on both sides, as well as loss of consciousness. Then you have something called focal seizures, where the seizure activity occurs only at a particular part of the body. It does not occur all over the body, just occurs over a part of the body. So seizures can be, as I said before, of different types. It is due to abnormal electrical activity of the brain, and it results in difficulties for the patient and as well as the onlookers. Now, what are the precipitating factors for a seizure? Now, seizures can be precipitated by a lot of our own activity. Lack of sleep is one of the most important things which can happen. If you do not get your sleep, 6 hours or 8 hours sleep, a patient who's had epilepsy or seizures are liable to develop more and more seizures if they do not get good sleep. Where basically what we advise about 7 to 8 hours of sleep for a patient with seizure disorder. Then the other important things which can precipitate seizures are lights, disco lights, which are flashing into your eyes. If you keep looking at those eyes, that can stimulate, or this can stimulate the brain and can lead to epileptic activity. Then you have some emotional stress can sometimes cause it. Loud sounds can precipitate it. Anything, and over a period of time, one will be able to understand what are the precipitating factors which will cause a seizure in that particular person. It differs from person to person. So that is one of the most important things that one should understand, that there are certain things which we can avoid and thereby prevent a seizure from happening. The other thing to know is, before a seizure, will you be aware that a seizure is coming on or not? Yes, that is also very important, because there are certain kinds of seizures where one gets an aura, or one feels that there is something is going to happen. I'm not feeling well. My eyesight is getting affected, or I am getting a strange smell, or there is something wrong in my stomach. It's boiling up like that. If you get these kinds of sensation, following which you develop a seizure, you will know that that is an aura which happens before the seizure. And so the most important thing is about the aura is, once you know, or once you've identified the aura, you will be able to identify the onset of seizure. Why is that important? It is important because if you know you are going to get a seizure, you can prevent harm from happening to you. What happens when a person develops a seizure is he or she will lose consciousness and fall down. And usually what happens is they will hurt themselves, they will have head injury, or they will develop fractures of the bones or the vertebra, etc., etc. So the most important thing about one has to do regarding seizure is that if you have an aura and you know it's going to happen, you have to immediately sit down in a place or lie down. If you can do that, you can prevent that fall from happening. So that is very important in our lives, that we should understand how a seizure happens to us what are the precipitating factors, how it can be prevented, and what we should do to if it occurs. Now, what should we do when a seizure occurs? You know that a seizure is going to happen. You immediately lie down and call for help. If you lose your consciousness before that, before you sit down, before you call for help, then you are liable to fall down abruptly and hurt yourself. So that is very important for us to understand. The other thing is that what are the dangers of this seizure happening? Suppose you're working on the top of a building. When you're working there and you develop a seizure, you will fall down from the top of the building down, and you will definitely develop fractures, head injury, and so on. What happens if you go for swimming and develop a seizure? Yeah, you can get drowned. That is one of the problems of seizures. Now, the other important thing is that, can a person with seizure drive a heavy vehicle, let's say a bus or a train, etc.? No, he should never do that, because sometimes seizure happens without an aura. And when it happens without an aura, that person will suddenly lose consciousness, lose control of his vehicle, and it will go and hit against others, kill people inside it and outside the vehicle. So those who drive heavy vehicles, if they have seizures, they should immediately stop doing that. Even driving is proper. Even for small vehicles, two-wheelers, cars, all these are in India. We do not allow people with seizures to drive these vehicles. But abroad, in US, UK, etc., there is a short time interval. If you do not have a seizure, let's say 3 months, 6 months, or up to 2 years, then you are allowed to drive. But not so in India. Any person who has a seizure, whether it is controlled or not, is immaterial. He is not allowed to drive a vehicle because it can harm the other people around him. So these are some of the very important things that one should understand about seizures. And the other thing, which how do you recognize a seizure happening in an individual? When you come to a doctor, what are the things that you should tell the doctor, or what are the things that he expects from you? That is also something which you should know. Because only by giving a proper history to the doctor will you be able to allow him to make a diagnosis of the particular type of seizure that you have. And diagnosing what type of seizure you have is very important, because different medicines are given for different epilepsies or different seizures. And if you give certain kinds of seizure medicines for certain other types of seizures, you are liable to precipitate that seizure. So these things also should be kept in mind, so that when you go to a doctor who is treating you, you have to tell him all about what happened before the seizure came on, what happened during the seizure, which you may not know, but you have to get information from people who have seen you have the seizure. Then you will have to tell him about what are the things which happened after the seizure and how were you feeling after the seizure. So some of the important points which you should note down is that you should be able to tell the doctor whether you've had an aura telling you that the seizure is going to happen, whether there was sweating before, whether there was an abnormal sensation in the pit of your stomach. All these things will give the doctor an idea about what type of epilepsy you had or what type of seizure you had. Then, during the seizure, where did the seizure start from? Did it start from your right hand or right leg or left hand or left thumb? Where did it start from? Did it spread from one part of the body to the other? And during the period of seizure, did you lose consciousness? How long did you have the seizure? All these things are very critical to make a proper diagnosis of the seizure. Then coming to what happens after the seizure. So once the seizure has occurred, most of the seizures go away by themselves. And if a seizure lasts for more than 5 minutes, then it becomes an emergency. And you will have to be taken to a hospital equipped with facilities to treat that particular kind of problem. So a seizure which happens for more than 5 minutes is dangerous. It's an emergency. Now, when you go to the doctor, you have to tell him what happened after the seizure also. Did you have headaches after the seizure? Did you unknowingly pass urine or did you pass motion at that time? Did you have a weakness of one side of the body following the seizure? Did you develop weakness of the limbs? All these things are very important to make a proper diagnosis of seizure. Now coming to the type of drugs that we use for seizures. Now, the important thing about the drugs for seizure is that most of the drugs have got side effects. That doesn't mean you have to stop taking those drugs. You have to, one, the doctor will assess the benefit and the risk associated with each drug and give you only drugs which are beneficial to you. But all drugs, irrespective of for what it is given, not only for seizures, for any other thing, will have side effects. But we decide on the course, on the drug, based on the benefits that the patient has. So do not ever stop a drug because somebody says that this drug has got side effects like this. You will lose your hair, your blood will go bad, etc., etc. You should never listen to that. You should only listen to your doctor and take the drugs as prescribed by him. Regarding the drugs, another very important thing that you should remember is that a woman in her reproductive age, that is between 18 to, or let's say 15 to 45 or 50, they should be very careful about what drugs they're taking. And while they are on the drugs, if they get pregnant, then they are like their child is liable to develop problems. So not all the drugs do produce pregnancy-related problems, but some of them do, and one has to be very careful. If you are planning to conceive, then you should definitely tell to your doctor that you are going to try to have a baby, and so that he will be able to change the drugs into drugs which are very safe during pregnancy. That is also something that you should understand and you should be aware about. The other most important thing is you should never stop an epilepsy drug by yourself. If you stop an epilepsy drug by yourself, it will rebound and cause seizures, which might be very difficult to control also. So one has to be very, very careful. One has to know about one's particular disease and one has to understand the disease, why it is happening, what are the things which will precipitate it, what happens during the seizure, how can it be treated, what are the things that you need to tell your doctor, and about your medicines also. You should always carry a list with you telling the name of the medicine, the dose which you are taking, how many times per day you are taking it, etc. You should always have it with you. And you should also have an emergency number from which people can call you and call your near relatives and tell them that, yes, this person had a seizure, please come and see him here in the hospital. So your contact number should be there. Not your contact number, but your emergency contact numbers should be there. And you should always understand that seizures by themselves are not dangerous. But if untreated, they can progress into what is called as status epilepsy. And that is very dangerous and it's also life-threatening. So one has to know about the disease, about the drugs, and about what to do when a person develops a seizure. So what is to be done when your friend develops a seizure? You have to immediately make him lie down on the floor. If he undergoes jerky movements, let it continue. Meanwhile, make sure that people don't crowd around and create lack of oxygen to the patient. He should be made to lie on his side so that he does not aspirate any vomitus or saliva which is there in his mouth. So that is to be prevented because aspiration pneumonia is one of the dangerous consequences of a seizure disorder, of a seizure. So one should always be ready to put the patient on his side and make sure that he does not aspirate whatever is there in his mouth. Many people think that putting an iron rod or a key in his hands will reduce the seizure or stop the seizure. It's not so. Iron does not have any role in this. What you should do is make sure that the patient gets enough oxygen or air around him. There is some breathing space for him. Make him lie down on the floor. Make sure that he doesn't hurt himself while he's throwing the seizure, and take out any dentures which he may have in his mouth, and make sure that he is safe, and take him to the nearest hospital so that they will be able to find out the cause for the seizure and treat it. The last thing which I want to tell you is what to do. How can you help someone with seizure? Seizure, as you know, is not a contagious disease. It will never spread from one person to another like COVID. After COVID, everybody is scared of diseases. But epilepsy is not contagious. It can never spread from one person to another. It happens because of a abnormality in the brain. Sometimes about 50% of seizures might have a particular cause, like a tumor in the brain, or a bleeding in the brain, or a stroke in the brain, or infections in the brain. But there are another 50% where a doctor cannot find out any reason whatsoever for the seizure. This is also there. You have to understand that all seizures do not have a particular reason why it has occurred. It can be due to, sometimes if you don't take enough salt, that can also precipitate seizure. If your blood sugar levels goes down very much or goes up very much, that can also induce a seizure. So many different possibilities are there for seizures occurring. And can you get married or not when you have a seizure disorder? That is a very important question which people often come and ask me. Can I get married? Yes, you can get married. But be sure that you tell your would-be partner that you have this particular problem and that you are taking drugs for this particular medicine, for this particular disease. And make him understand about the seizure. If he is still worried about it, you can take him to your doctor and ask him to explain about the seizure, about the medicines that you are taking, to make sure that he understands what he is getting into. You know, many girls and many families try to hide the fact that they are on drugs for epilepsy. And as a result of which, when they get married and during the first 1 week or 2 weeks, they will try to stop taking medicines. And because they have put to a lot of stress during the first week, what happens to them? They forget the medicines, they don't take it, and it results in a seizure happening when everybody is there. In their in-laws' house, when everybody is looking at the girl, suddenly she throws a fit. And that is catastrophic. It is so injurious, or I should say so hurting to the people who don't know that this particular person has seizure. To be suddenly your daughter-in-law has a seizure and you are left wondering what is going wrong. So this should not happen. If one is planning to get married, one should always be open about it and tell that particular person that you have this particular problem. You are taking medicine so that it is not contagious. It does not produce any other problem other than this increased electrical activity in the brain. This increased electrical activity, when it spreads to different parts of the brain, it will produce that seizure. That is what one has to understand. I hope I have been able to give you an idea about how a seizure occurs, why it occurs, what are the things which can precipitate a seizure, what to do if you have a seizure, how you should approach a doctor and tell him what are the things that you should tell him when you see him, and lastly about the various medicines which are there. Most of the diseases, most of the seizures, I should say, are controllable with medicines. A few of the seizures cannot be controlled with seizures, and that is where we neurosurgeons come up. We will take out that area where the focus of seizure is and sometimes cure the problem. But many times these people will have multiple foci of seizure activity, and when one is taken out, another will wake up and start a seizure activity. So they may have to continue the drugs for some time. But seizure surgery is one of the options which is available for those with intractable seizures who cannot be controlled with multiple drugs. So that is the last point I wanted to. I hope you were able to understand what I wanted to convey, and I hope it helps you in your daily life. Thank you.